So high cholesterol has no symptoms. The only way you would know that your cholesterol is high is if your doctor tested your blood.
High blood cholesterol or hyperlipidemia is diagnosed based on a simple blood test called a cholesterol profile or a lipid panel, lipid profile. And this is done in your doctor's office very routinely. There are several different measurements that are important there. The first is the total cholesterol. For the average risk person, the total cholesterol should be less than 200. The LDL cholesterol, or so-called bad cholesterol, should be less than 130 for an average risk person. If a person has diabetes, then it should be less than 100 and possibly much lower. The HDL cholesterol is the quote good cholesterol, so we want that as high as possible, and it should be 60 or greater. And when we talk about the final measurement, these are triglycerides, and in a fasting specimen, we'd like those to be less than 150.
The risk factors for high cholesterol are diabetes, high blood pressure, being overweight or obese, smoking, or having a family history of early cardiac disease. Not everybody that has elevated cholesterol levels necessarily needs to be on a medication. Depending on the level and depending on your risk factors, sometimes we can have a patient change their lifestyle.
We want to be eating less saturated fat overall because saturated fat does increase LDL cholesterol, and we want to be adding more fiber to the diet. Adding more fiber to the diet can actually decrease cholesterol by 10%. And specifically beta-glucan, which is the type of soluble fiber that's in oats as well as barley.
So you want to put more of a focus on those healthier fats, which are unsaturated fats, incorporating more avocado, nuts and seeds, olive oil, and canola oil.
Medicine is recommended to treat high cholesterol based on an individual's particular set of circumstances. So if a person just has high cholesterol and they don't have any other risk factors, they don't have a family history, they don't have high blood pressure, they don't smoke, they don't have diabetes, then cholesterol may not need to be treated with medicine. But if a person is a diabetic, which is a huge risk factor for heart disease, or certainly if they've already had heart disease, like a heart attack, then we're much more aggressive in lowering their cholesterol with medicines. Probably the most important class of medicines for treating cholesterol are a class of drugs called statins. These drugs block an enzyme in the liver in the formation of cholesterol.
Trial after trial has shown us that when we use statins appropriately in patients that we feel would benefit from them, they have a decreased risk of developing heart attack, they have decreased risk of developing stroke, and there's a decreased risk of death. In certain but generally rare situations, there are other medications that we use for cholesterol lowering, such as fibrates, niacin, or ezetimibe. Now there's a new class of medicines called PCSK9 inhibitors, which work by a different way than statins, and they're used by injection. And some doctors are starting now to use them, particularly in patients that can't tolerate statin therapy.
Managing your cholesterol is a long-term investment in your health. You may not feel any different in the short term from lowering your cholesterol from 230 to 190, but you're giving yourself a better shot at a happy, healthy heart, healthy blood vessels, and a longer life.